Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia. Okay, Dr.
Good
Mencia.
morning. Good morning.
Dr.
Good
Mencia.
morning, Ina Lescovich.
Yeah.
Morning, Dr. Andy Mencia.
How are you today?
Wonderful. And
That's
yourself?
MENCIA.
That's right.
For those-
MENCIA, that's right. A lot
That
of
was
people
so
don't
funny
get
about that lady.
They don't get it, Mencia.
Mencia.
CIA.
Yeah.
Okay.
I think we're gonna drive Richard crazy. Poor Richard.
No.
I said, you
you're
guys
gonna
joke so
you're
much.
You're going to drive me crazy unless we talk about food.
Oh, yeah,
I
I'm
want to talk
so
about
hungry.
food because you have really you have an eclectic group of people there working, and they all want different kind of food. It's not an American office. I mean, it's American, but people.
It's a United Nations.
And the United Nations, and everybody likes different kinds of food.
Yes.
Okay, so but you have something that's unique at your center. People usually go to a doctor, and they may be obese or they may be overweight, and you have to send them
they may
somewhere.
have diabetes.
And you have to send them somewhere, but not in your case. Tell everybody why you decided to have now not only one nutritionist but three. Tell me why that's important to you.
I believe the dietitians, which is a higher level than just a nutritionist, require a lot more education than a nutritionist. Dietitians become important when you are trying to avoid giving patient pills for different conditions. So, if you go to a cardiologist and they see your cholesterol is slightly high or extremely high, they are going to put you on a pill. They're going to tell you that you have to follow a good diet. They're going to give you some brochure that you won't understand.
Yeah, lots of love.
And I lecture to a lot of physicians, and they have the prejudice that people basically will not follow a proper diet, that they need pills in order for you to control them.
Is that right?
Exactly. And I believe that people deserve first the chance, and it becomes our duty as providers to motivate the patient to follow a good diet. So, sometimes when I see that a patient has borderline diabetes, I don't run to the dietitian. I sit down with that patient. I try to motivate them. I explain to them why they need to follow that diet, and the same thing for patients with high blood pressure. I have a priest that come to my office, and I've been working with him for about 8 to 9 years, and his blood pressure is well controlled, and he said, I'm just going to do holistic care. I'm going to lose weight. I'm going to follow a good diet. And he's from Haiti. He's a priest from Haiti. So, when he went to see the dietitian, we work with his culture and his diet. So, and I tell my patients, if, let's say you have borderline diabetes, we cannot change a Chinese person to now follow an American diabetic diet. Basically, we follow the concept of the American diabetic diet, but then you go back and try to extrapolate that into your own culture. So, for example, a person with diabetes, I tell them, I'm going to give you Mencia's diet for diabetes. And it's
Mencia's diet?
And it's very simple because you don't have to count calories. All you have to do is recognize the starches. And this is pencil talk, you can write them down. Rice, pasta, bread, potato. Rice, pasta, bread, potato. You take those starches, and then you look at your diet and cut it down by half. So let's say if you eat 6 slices of bread a day, now you're going to eat 3. If you eat half a plate of potato, like Ina with her Russian
Yeah, we're
culture.
going to get to,
Yeah.
we're working on this.
If you eat half a plate of potato, you're going to eat now 1/4 of a plate. So you cut everything down by half. And then the other family that can increase your sugar that come from natural sugar are the fruits. So if you are a diabetic and you're juicing with a lot of fruit, that's going to mess up your sugar because your body cannot handle that much fruits, that much, sugar. It's all natural sugar, which means the body is going to take it all the way in. So cut down on the amount of fruits that you eat by half, and select your fruits. If you have constipation, take fruits that are more fiber loaded than no fiber loaded. If you have gastritis, take anti-inflammatory fruit like papaya and stuff like that, and avoid the acidic one like pineapple. So, you can tailor your diet, and basically I do this in a few minutes with the patient and tell them, and my nurse will sit down and write it down for them so they can go home and try to follow this simple diet. And I tell them, if they are just barely making it above the norm for non-diabetic, I tell them I will guarantee you in 3 months when I recheck your lab, all your numbers are going to be back on the normal side.
Because Dr. Mencia, most people don't want to take medication, do they? So if you say, if you do this, you're not going to have to take medication. If you don't, then that's what we're going to have to do. So they have a choice.
And there is a stigma on medication. When you take medication, you go to work and somebody see your bottle of medicine. People look at you different. Oh, he or she is taking medication for something. I don't know what it is, but he must be sick.
But
you
also,
are not taking it because you are sick. There are pills out there for diabetes that won't lower your sugar below normal. Just work on your sugar. There are so many pills out there now. The regimen for diabetes have revolutionized over the past 5 to 10 years incredibly. There are so many type of pills. There are some that work on your kidneys to make your kidney sort of fool the kidney and make the sugar just go into the urine instead of being reabsorbed back. There are pills that work in your guts that they have an alarm clock. They only get activated when you eat. So when you eat these hormones that you take, and it's no insulin, will get activated and will make sure it will help you digest sugar much faster, so your level will not rise. And some of those new pills now, it's not like insulin, like the old regimen from before, that will give you low sugar, and you have to quickly eat something because your sugar went down too low. The new medication won't do that. Some of the old medication will make you gain weight. The new medication make you lose weight.
But Dr. Mencia, when you watch television and you see all the commercials for all that, everyone, though, has something that will either you won't be able to have sex anymore, or you won't be able to have this anymore. So taking medication, even though maybe it's very good in some cases, let's avoid it.
We can avoid it. We can avoid it. And people need to understand, those pharmaceutical companies, they are multi-billion-dollar, corporations. So they can afford to put commercial every time and everywhere, when you're on the radio, driving your car, when you're watching TV, when you're doing anything, when you open your phone to go on, and do some Google search, they're going to bombard you with advertisement, trying to get you to ask your doctor for some medication.
No, it's better but you do you do. That's
you can do
wonderful.
it. Yeah, you can do it without medication. Many of these conditions, high blood pressure, diabetes, a lot of these conditions you can do without medication if you follow a good diet.
Well,
so going back to the diet,
let's really talk about the
diet. Using salt.
Oh, I was just going to go through salt.
Yeah, using salt. They talk about sea salt, and it's not the type of salt as much as how much salt you use. The body needs salt. Salt in our body is called sodium. And if you go now and open your blood test that your doctor gave you from whenever, go back and look for the word sodium. And sodium is salt. And next to sodium, usually very close to sodium, you're going to see chloride. So sodium and chlorine, the two chemical, because sodium is positive, chloride is negative, they make up salt. Sodium and chloride, they usually go hand in hand throughout the cells. So what usually follow the salt is water. So if you have a membrane and you put salt and water on one side and you put just plain water on the other side of the membrane, the plain water is going to be sucked into the salty side because salt want to have more water, and therefore too much salt, what it does, it will dehydrate you, make you thirsty, make you drink more. That's why when you go to a restaurant, they want to give you food that are salty taste because it will make you drink more. And you go through 1, 2, 3 bottles of wine because the food is salty. If you're drinking beer, you're gonna have, a case of beer because it's so salty. You want to keep drinking.
Excuse me, beer is salty?
No.
Oh.
The food is salty.
So
So if you are
more
drinking
beer,
beer, so
that.
you want to drink more beer to sort of fight the dehydration that those salts are going to produce in your cells.
Well, I know that Ina is sitting here, and I know that she comes from, a Slavic country. I guess Russia is Slavic. Is that?
No. Winter. Who we blame winter on? Not only they messed up with the election, they blame winter in Siberia, in her part of Russia. You know that?
And I've been to Siberia.
If you look at the map and you see Siberia, we call the North Pole wind that comes down.
Right.
If you really look at the map, going to the weather map, you look at the map and you see Siberia, the wind that comes from Siberia go into the North Pole by Alaska and then shoot straight down into Washington State and all that stuff.
So you're the reason, right? She's the
Us
reason.
in America, we have winter because you guys keep blowing this way.
That's it.
Okay. He's bad. I knew he'd get you
I
somehow.
love Russians anyway.
But I want to talk about the kind of food that the Europeans, I don't know if they still do it, but I remember when Europeans came, their food was very, very natural. It is today. I mean, there are a lot of people who are eating, instead of having cans of tomato soup, cans of tomato, you bought tomatoes.
Fresh.
We
fresh
don't
tomatoes.
buy canned food.
Okay.
We don't believe in eating. We don't believe in eating canned food. Only in America I saw canned soup.
Everything
And when I
is
tried
made.
it tastes disgusting.
Right.
It tastes like
So-
It's
full
a
of
different
salt.
taste.
Okay,
yeah.
so now, nutrition-wise, isn't it better to do it naturally the way Ina
Of course.
is talking
Of course.
about it?
Yes,
So
absolutely.
you get onion and garlic.
And we bake a lot. We don't cook a lot of
You
cook.
bake
So
a
we
lot.
bake a lot. Mm-hmm.
So,
Even, if you look at Russia as a country, if you go to St. Petersburg, I've been there and it's a very, developed city. Moscow, very developed. They eat more canned than fresh.
Americanized. They've been
Yeah,
Americanized.
exactly.
Nowadays, maybe.
But in Siberia, in the northern part, they still believe in, more natural stuff. Same thing when you go to Germany. You're going to the main city. The people now, they're trying to be more civilized and they want to eat canned stuff to be quick and go to work. But still in the outer skirt,
People do a lot of gardening.
they still do a lot
They-
of gardening. They grow their own vegetable and
Even home, an apartment, my mom grows on the window,
on the-
the onion and all
Really?
that. Mhm.
Even on the window, because that's what they had.
Yes.
Well, I
Even
come,
in a big city, people
yeah, well,
like to do
I come
that.
from a Hungarian background, and I remember my grandmother and my mother taught. I cook a lot because I know what my mother did, and I cook very healthy. So, and I rarely salt anything. As a matter of fact, I if someone wants salt, it gets on the table, do it, but I don't salt the stuff.
I remember, my mother will go outside. If she need mint, she will go outside. She has the plants and she will grab the leaves of the mint and go inside. And, different thing that she will need will be outside. And she just grab a few from the plant for to cook that day.
Because you were talking about salt. If you look at cans and look at the salt, because it's a
great
preservative,
amount.
right? And so the same thing with when you, you're going out to dinner. I mean, and it's delicious, but I hate to think how much salt goes into the restaurant food.
Yes. We can do a class action lawsuit against hemp company.
But
Hey, we done it against the cigarette. We can do it. Do you know how many people end up in the emergency room with congestive heart failure? Because they eat. And a lot of times, when we see the patient in the emergency room in congestive heart failure for the first time, we ask them, do you eat any canned ham or anything like that? And a lot of times they say, oh, yeah, last night I have some, and then I felt kind of heavy. Then I couldn't breathe, and then my wife or my husband brought me to the ER.
So it's the food that's causing this.
Of course, because it's all, salt is a great preservative. When we didn't have refrigerator, we used to take the meat
a lot of salt.
and put a lot of salt and put it on top of the house. So it stayed there. So the animal will not eat it. They will put the meat on top of the house. And full of salt.
Well,
that was a preservative.
Right. So salads. Let's just go back to salads. I think now the whole new thing, and I don't know if it's a health food craze, but people do the salad and they put their meat or their fish or something on the salad, but then they put that dressing on.
Exactly.
And that's like, why
That's
bother?
the killer. That's the killer right there. And I tell my patients, sometimes their bad cholesterol is high. And I say, what kind of dressing are you using?
It's a dressing.
Oh, I use this kind or I use that kind. I say, that's your dressing is doing it to you.
So what kind of dressing do you think we should be having?
The
Just oil
vinaigrette,
and vinegar.
Oil and vinaigrette. That's enough. I don't even
Olive
put
oil.
salt.
Yeah, olive oil. Very, very important.
I
isn't
throw
it?
some flaxseed on my salad.
Yeah,
it's
for
the cholesterol. Throw some flaxseed.
Because of you, I have a big container of flaxseed. I put it in everything again, and cinnamon. And you told me about a few things, and it's wonderful. And then, of course, my magnesium, which I now do, which is great. But so let's just go back to then.
And then the salad. Wait, before we leave the salad and go to the main
salad.
course.
No, right.
The salad. The best salad is a colorful. Very simple. A very colorful salad is the best salad. It's the healthiest salad you're going to have.
What are we putting in it?
Peppers.
Yeah, pepper, green pepper,
Cucumbers.
red pepper, cucumber,
Tomatoes.
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 Tomato.
Okay.
In America,
Radish.
in America it's
Radish.
tomato.
Radish, definitely radish.
Yeah.
But how about...
Coffee's ready.
Oh, okay. Coffee's ready. But how about the kind of lettuce? Let's talk about, there's kale, and there's different kinds of lettuce,
Right.
and so it's important to...
Right. And you want
broccoli, there's broccoli lettuce, broccoli pieces and things in it. So that really can be your main course with some protein in there, right?
some dark olives.
Oh, yeah.
Yeah,
Dark
olives.
See, now I don't eat olives because I thought they're too rich or something. Should
No,
we be
you're
having
healthy.
olives?
Yeah, you want to have
Because that's
some
the olive
olives.
oil.
Exactly. So some dark olives are, so.
And the other, I was just telling somebody something. When I was growing up, we didn't have fast food. So we would go on a picnic. My mother would bring hard-boiled eggs. She would bring some cheese. We'd have whole wheat bread, something dark. We'd have apples. And didn't need refrigeration, really. We just went and we had but we don't do that anymore. We have to go stop and get all this fast food
The rush.
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 Yeah, it's the rush, but
Gobble,
there's...
gobble, gobble. Rush.
Gosh. That's a good point. Thanksgiving is coming up, right?
Yes.
So it's better. But let's get back to your patients. All right. So they come in and they need some help, and you have nutritionists. What do nutritionists do with them? What do they say to them?
Well, they start by like any medical or healthcare provider. They start by taking a good history on you. On your past and what kind of condition you have had and what concern you have, what brings you to the nutritionist, how motivated you are to work with a nutritionist. And you have different type of motivation. Somebody's there because, my wife want me to lose weight.
Or have a wedding.
I have a wedding to go to, so I need to lose 40 pounds.
You're 40 pounds right in a week. That's
Yeah.
a lot.
And then you have the other that come, well, I had a heart attack, and I don't want to have another one. I'm scared, and I need to help. I need some help. So people come with different type of motivation, different reasons. Regardless, when they are there, then what is the motivation? Why you want to see the nutritionist, and your medical history, because sometimes you come because you are concerned about the sugar, but you have some arthritis, you have high blood pressure, you have a little problem with your memory. So we pull all of those things together and say, let me see how we can help you, not only with the sugar, but also with the arthritis, also with your obesity or whatever. Or
So
the
you're
memory.
very involved with this whole process, aren't you?
Absolutely. The nutritionist is like another doctor. Some patient come to me and say, oh, Dr. Mencia, I just came to see you because my left big toes in my foot has an ingrowing nail, and I think I need antibiotic. And the first time you see me, I say, okay, so tell me about yourself. No, it's my big toes. Okay, but your big toes is attached to a human body, and I need to know the human body.
Interesting.
So, okay, let's make it quick. These are all my medication, and they put a bag of medication. I say, oops, okay. So you have diabetes that is poorly controlled, and you have high blood pressure that is poorly controlled, and you have peripheral vascular disease that is not allowing circulation to the big toes. And then we put the whole picture together, and we say, well, we need to work with your circulation. We need to work with your diabetes so that your toes can get better. And, you won't end up losing a toe, just, a little infection that you are concerned about. We can take care of that infection.
Okay, Dom, you got to stop for a minute because I have to tell everybody you've been listening to this wonderful, wonderful conversation. We have Dr. Andy Mencia here, and we have Ina.
Ina, I-N-N-A.
That's right, and she's there. When you come to the office, you'll be able to see her. She's very beautiful.
She handled the complaint department.
Yes.
She's so beautiful that people come with a complaint and they look at her and they merge. They say, no, I have no more complaints.
That's funny. Well, you see, you are a comprehensive medical. I don't want to go there, but anyway.
Let's not talk about sex.
No, let's not talk about sex.
No, yes.
Too early.
Okay, all right. Well, let's just talk about AGI Medical and Dental Centers. Remember that name. It's really important. Of course, they've been in Fort Lauderdale for many years, but now they have another wonderful office in Boynton Beach. Let me give you the phone number for you today. If you are overweight or you are not feeling well, you can go there today, and they'll get you started with a dietitian, and Dr. Mencia will see you. And so let me give you a phone number. Try to make an appointment. It's easier if you do. If you have an emergency, you can just drop in. But it's 954-489-1345. Again, 954-489-1345. And the one thing that I love about them is they do home visit services if you're homebound. And then let me give you their website. It's agifl.com. agifl.com. And Dr. Mencia, when we come back after the 7 o'clock, I think we ought to probably talk a little bit about that we do have the Cure Symposium coming up, and that you will be there with...
I will be there.
Yeah, you'll be there with a couple of other people talking about telemedicine, which everybody is exciting about. And I was wondering if on telemedicine, could we do something with nutrition? Let's think about that. So we'll be able to do that also.
Yes.
So, but I just want everyone to know that Dr. Mencia is my physician, but he is so much more than a physician. He uses his psychology training, but he really has a huge heart. Let's just say a big heart. And he has so many practitioners there within his organization. And if you need to have a neurologist or cardiologist or the dietitian, sleep apnea, the biggest thing is their dental department. And he can talk a little bit about that too.
Yeah.
I mean, I don't think there's anybody other than...
No, it's a great concept.
Yeah,
I mean,
really
some of us, who knows, some of our listeners might open their directory with the telephone, and pick up their phone and call, "Hi, Hillary. This is Mrs. Smith. I'm just calling you. I want you, when you are in Florida, come and see Dr. Mencia so you learn something."
Yeah.
Hi, Donald. Hi, Donald. This is Mrs. Smith. Listen, come and see Dr. Mencia so you learn something
No, yeah, right.
about health care. He can give you some hints.
Oh, you're right. Well, healthcare is a very big thing because we haven't talked about that, but I know that you must be seeing a lot of people now who didn't have healthcare, and now they can come and get some good health. So, well, we
want health care to improve. We don't want hair.
Right.
We
No.
want health.
People.
Rachel, we want health, not hair care.
You know, I have to say, but you're always in such good shape. So, whatever you're doing in your life, I mean, I don't know if you're 90 years old or you're 20, but whatever
I have a model that she's have a beautiful body, and she goes to a basketball court, and she get naked. She has a sign that say, "If you catch me, I'm yours." And I run after her every day for half an hour.
That's what it must be. But we'll be back
Rachel,
right after.
I'll give you the formula, Rachel.
Yeah, right. Okay, we're going to be back right after the news, and we're going to talk more about eating properly and our Cure Symposium. Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.